Oh, please, come on in. Come on in. Hi, good to see you. I'm Dr. Rocky. I think it's been quite a while since last time, hasn't it? Well, I think so. Indeed, I think it's been quite a few months indeed. Well, here we are again, and it's terrific to see you again. So, what can I do for you today? A checkup. Alright. No, this is just a regular annual checkup. Alright. We could definitely do a cranial nerve exam, a limited cranial nerve exam in this case, if that's what you want. Then we will do that today, a cranial nerve exam. We'll do an annual checkup with that as well, but we'll do some extra tests regarding your senses, of course. Good. Well then, that's clear already. But before we start, I would like to know, how have you been? How have you been in the last few months? Alright, well, that's great to hear. I mean, I can see that. Well, it's quite obvious that it's going well. Well, I'm glad to hear that, and that's what I like to see with my patients, especially my favorite patients, of course. There is such things as favorite patients, I tell you. But I'm very happy to hear that. Oh, definitely, most definitely. So, last time when you came, we did a checkup, and you had some allergies and some visual problems regarding your vision. A little bit of redness in your eyes, and itchiness, if I recall rightly. So, how is that going? Is that clearing up? Because I don't see any immediate signs of irritated eyes or anything like that, so I presume it's going way better with that as well. Yeah. Alright, well I'm very delighted to hear that. So it did work, the eye drops? Okay. Well, very good. No, that's terrific. No, I'm very happy to hear that. So that's all sorted then, so we don't have to worry about that. That's a good sign, that's a positive sign. Now, so no troubles of the allergies, no troubles of the eyes, or at least no reoccurrence of the problem. Anything else in the last few months that has cured sickness, COVID, the flu, or cold, stuff like that? A little bit of cold, yeah, alright. But no big things like, I don't know, broken bones or anything like that. Okay, good. Well, then I'm happy to hear that. Family going well too? I see. Alright. Oh, well, yeah, I'm doing fine too. Can't complain. Had a few good months. Busy with lots of work-related stuff. Some conventions, some courses that I'd had to attend to. Because the world of science never stops, does it? And so does the medication world. There's always new things to learn, and it just keeps evolving. So, yes, quite busy, and thank you for asking. So, let's see. I'll be asking some questions during the tests I'll be conducting today, and I want you just to answer truthfully to those questions. Of course, I just have to say that. But yeah, I'll just do some tests regarding the face structure to feel if there's any tender spots, if anything hurts. I'll be testing the eyes, obviously, with the light. I'll be checking it if I see any signs of dehydrations in the eye, irritation, allergies, etc. Now the nurse, I believe she has tested your blood. Hence the reason I have that, so that's good. Your weight, your height has been checked. Now they all seem to be positive. Nothing wrong with that. So that's good. Blood pressure is fine too. So that's good. I'm very happy to hear that. So, like I said, we'll be testing the eyes, we'll be testing the skin, just feeling all the muscles and the skin to see if there's any tender spots, if there's any places that hurt. Now, besides that, we'll do some tests with the muscle reflexes, like with your arms and elbows and hands and things like that. Besides that, I will make you do some things regarding some motor functions or your coordination with your finger and your nose, obviously. I'll be testing your sense of smell and taste, and then a little few other tiny little things. Alright? And your sight, indeed, of course. Alright, good. Now, first of all, I will start with something that's not in the test officially. I will start to listen to your heart, just I want to hear that myself, and your lungs, obviously. So if you just remain calm and just nicely seated like that, and lift up your t-shirt for me. Thank you very much. Now I'll be doing the heart first, so may I? This may be a little bit cold. My apologies. Now, just keep breathing slowly. Alright, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alright. That's the heart. That's a nice of 78, and then the heart rate is positive. No signs of any decomposition and peeping, and then that's fine. Yeah, that's fine. Alright, now we'll be doing the lungs as well, and here is just very important, just to stay calm, so just stay calm for me. Now I want you to breathe in slowly and deeply with me, and out. Very good. Again, one more. Alright, very good. Now take a deep breath in and out, in and out. One more time here, in and out. One more time here in the other lung, in and out, in and out. Very good. That sounds perfectly fine to me. I don't hear any peep or anything else that worries me, which is a clear sign that your lungs are okay. I still want to listen once at the back there. And now again, take a deep breath in and a deep breath out. Very good. One more time. Alright, very good. The other side. Take a deep breath in and out. One more time. Good. That's all good. So I'm happy with that. Yeah. How am I gonna formulate that? There's nothing wrong with it. Yeah. Seems about right. Anyway, what we're gonna do now is we're gonna go on to the next test. The next test is just gonna be the eyes. We're gonna check the eyes. And here it's important to stay focused at all time. Don't get distracted with anything. The fly at the wall, or anything default that I make. Well, you know what I mean. So yeah, just remain focused at all times. Highly important, because it may alter your results. And we don't want that, do we? So, now I'm gonna ask you to go back a little. Good. Alright. Now, behind me, you see a nice paper, right? Good. I'll just get out of the way for you. Now, can you tell me what the second row says? The second row. Yes. Yes. And we go to the fifth. Can you tell me all the letters starting from left to right? Right there. Yes. No. That's a C. Yes. Yes. Can you read anything from the seventh row? Uh-huh. Yeah. Yeah. It's getting more difficult now, isn't it? Totally normal, don't worry. Alright, and can you see any of these? You can. What's that? No, that's not possible. What about that? And what if you try this? Does it get any easier then? Can you try to read that? Yes. 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 So that's possible with that. Most interesting, I tell you that. Alright. Well, it's good to know that. So, we'll have to maybe put you through to an actual eye doctor, my colleague, to really look at that. Because that may be worth looking at least to see if that might improve an eyesight or anything like that. Because, of course, we want it to all be fine and to you have perfect eyesight. So, this is better. Or not? You can see clear. Yeah, okay. And that. So you can see all the ones there, the 7th row? Easy as well. Okay. Yeah, then I definitely will refer you to, to somebody. Might help. No, I don't mean that in a nasty way. Oh, I easily could, but I'm not. I think it might be just quite an improvement on your sight. Not that side of luck. Before I get any complaints from HR again. That was the cause as well, because I was not kind to patients apparently. I seem very kind of thing, but well, let's leave that out of it, shall we? Alright, anyway, I'm just kidding with you. Anyway, now stay like that. What we're gonna do now is take a closer look at your eyes. What I want you to do is I want you to look straight ahead, just keep your head still. Very good. And what I want you to do is I just want you to follow the light. Just want you to follow this light. Just keep following that and keep your head still, but just move your eyes. That's all you have to do, okay? Very good. Now keep just following. Just follow that light. Nothing else. Just follow that light and nothing else. Very good. Keep following that light and nothing else. Perfect. Keep your head still, remember? Keep your head still. Just follow the light. We're almost done with it. Very good. Good. Just gonna check your peripheral vision. Now I want you to look straight to my nose. Just look straight ahead at least. Very good, because if you look at my nose you can look quite far away. Anyway, just keep looking at one point, and we're going to check your peripheral vision, which just means the outside vision. So you have this vision and that vision on the side. Now just tell me whenever you see that light popping up. Okay, very good. 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 And very good. Alright. Yeah, no, it's totally fine. I don't see any things that are out of the ordinary. Besides what we've seen with the previous test, that with glasses it goes a bit better regarding looking at the list behind me. But peripheral vision and just in general, just following the light seem to be just going fine. So I don't see anything wrong with anything else. So that's good. Right now, there's one thing I'd like to do more. So I just want you to do whatever, but I just want to get a little bit closer with you. If you don't mind, sorry. I apologize for my breath. I've just been too good time. So I just want you to look straight ahead for me right now. Okay. Look above. Look up, look up, look up. What I'm doing is I'm just checking if I see anything in your eyes that's out of the ordinary or that concern me. But it all looks just nice to me. It's just nice and white. I don't see a lot of red, so nice and white as it should be, so that's good. Yeah, it's always good to see a lot of white, because if you see a lot of red, which is normal, then it might indicate irritation or anything else like allergies, and we don't want that, obviously. There's of course some red, which is just the veins, obviously. That's good. There's a good amount of it. Now look down for me, please. Yes, thank you. Now just keep looking down, don't move too much. Very good. That looks all very nice. Your tear ducts look fine to me as well. Look to the left. Both eyes to the left, thank you very much. Yeah, that looks all wonderful. Excellent. Excellent indeed. Look to the right one more time for me. Yes, that looks wonderful. That looks nice, yes. Look straight ahead one more time. And up, and down, and right, and left. Okay. That's good. Alright, now the taste and smell test. That's a very simple one. What I'm gonna do is I'm gonna conduct a little experiment. I've got a bottle here, and this bottle contains a fluid, and this bottle, a few of them, has a distinctive taste. Now I want you to put out your tongue I'm just going to put a drop on that. How does that taste? Good, okay. But what is it? Strawberry. Excellent. Let me put that away. Let me get the next one. Indeed. Vanilla. Alright, that's fine for that. The smell, same principle. Now let me get a thing. I've got a little cup with some fluid in there. What does it smell like? Coffee. Hold on. No, I need to throw that. No, this is not going to smell like poo, don't worry. Not that horrendous. Just going to put a little bit on there. And what does that smell like? Quite close. It's diesel, but gasoline. Pretty much the same. That smells. Alright. Now, that can go. Good. The last thing I want to do today before we end our lovely session is I just want to feel your face. I'm just gonna feel it from top to bottom, and I want you to tell me if anything hurts or feels tender, alright? No pain here, no pain there, and does it hurt here? And there, around the mouth, around the nose, doesn't hurt, alright? And chin area, does that hurt? Quite frequently it hurts here because people lay a lot of pressure on that, but doesn't hurt, very good. And then the neck, and then on the cheeks, can you puff out your cheeks? Very good. Can you laugh? Stop that. Can you look angry? Can you look surprised? Can you look furious? It's basically something very good. Happy, angry, surprised we did as well. Again, surprised, very good. Yeah, fine, all fine with me. Then one more test before I forget. The muscles, I want you to stretch your arms straight like that, and I'm going to push them down, but I want you to fight against it, alright? 3, 2, 1, push against, push against. Okay, same way, but the other way around. I'm going to push them up, fight me. Okay, very good. Make an elbow like this, very good. I'm going to try to pull it forward, and you have to fight me. Good. The legs, make them nice and loose, let them dangle a bit. Just relax. Just relax. Don't worry. Just relax, let them loose. Loose, loose, loose. Good, yeah, that's fine. Now, same here, I want you to let them loose, and I want you to try to get them down. I'm going to try to pull them up, but you have to, yeah, alright. 3, 2, 1. Another one. Okay. That's fine. There's lots of power in there. Lots of muscle strength, left and right. Leg, arms are fine. The muscle reflex seems to be intact. Alright, well that's good. Then I have nothing more to test or to say really, besides that it's all fine. So that's great. Good. regarding the eyes, I will send you through to Dr. Reinhardt. Dr. Reinhardt will conduct a test on you, on your eyes. Dr. Reinhardt is on vacation, so I will send you through to this new one, Dr. Friedrich. Dr. Friedrich, he's new, yeah. Yeah, he's a funny fella. Anyway, I will send you through to him, Dr. Friedrich, on the 5th floor, all by himself there. You can go to him and he will conduct an eye test on you, I presume. Yeah. So that's today if you want. Yeah? Alright. Then just give this to the reception up front and then they will send you through to the lift. Thank you enormously for coming. Do you have any questions? No? Alright. Well, good. Then we're done here for today. The results will be on the online medical file, so you can read it back there, all the results that I will put in the system. And if there's no more further questions, then I hope to not see you again soon. Alright, thank you very much. Have a wonderful day, and thank you, and bye-bye. Goodbye. Goodbye.